Hi, my name's Hayley and this is Susan, and welcome to Cancer Research Demystified. Today we're going to delve into one of our own projects. So we're going to do my main project, which is INNOVATE.
Okay, so INNOVATE, what's it all about?
Okay, so has anyone heard of Movember? It's a big charity event. It comes around once a year in November. In fact, I think they do things all year round. And it's raising money for men's health issues. One of the main things they do is moustaches.
Yep.
So people either grow them or, well, stick them on.
Fake ones.
Which we have got ourselves into. But they raise money for men's health charities, and a few years ago they got together with Prostate Cancer UK, and their money they raised they used to sponsor a clinical trial. And that's called INNOVATE, and the idea is to improve the diagnosis of prostate cancer.
So how is prostate cancer diagnosed currently, before we get into the new stuff?
Okay, so normally you would be referred from your GP with a suspicion for prostate cancer, and the things that will cause that referral, you've got urinary tract symptoms, you've got a blood test called PSA, or you might have what's called a digital rectal exam, where they feel to see if your prostate feels abnormal, and those things, any of those things combined, can cause a referral to the hospital, and they'll talk to you and they'll say we're suspicious you might have prostate cancer. So none of these things are actually specific for prostate cancer, especially the PSA. So that's called prostate-specific antigen. So even from the name, we know it's to do with the prostate, not particularly cancer. So you can have a raised PSA if you have other non-cancerous prostate conditions. Benign growth, inflammation, sometimes even just vigorous exercise can cause an increase in PSA. For example,
a bicycle, right?
Yeah.
So because these things aren't very specific, it means that a lot of men are actually referred to hospital that turn out not to have prostate cancer. So we do have a number on that. Actually, there was a study called Be Clear on Cancer, and it said only 12% of these men that are referred to hospital actually have prostate cancer. So for everyone else, that's really stressful and there isn't much point.
Yeah, it's a lot of men.
It's a lot of men. So this is where the INNOVATE trial comes in. So there's two different halves to this trial, both to make diagnosis of prostate cancer a little bit better, a little bit more sophisticated. So Hayley, do you want to tell us about the first half?
Okay, so the first half is blood and urine. So I go over to the hospital, I meet the patients, and if they consent to the trial, I collect both blood and urine samples from them, and I bring them back to the lab, and then I spend the evening or the next few hours processing them, get them ready for analysis. So that's quite a lot of work. I get a lot of tubes, so I do that most days, unless I'm on holiday, and then someone else has to do it.
And it's me. And it's late at night as well, because this is research, right?
Yeah.
So we can't do it like during the normal hours of a hospital, so that's why we're often here late at night in the dark, just toiling away, petting tubes of urine. You know, it's a glamorous lifestyle.
So once they're all processed and once we've got a batch of them ready, we'll be doing some new clinical tests on them. So the idea is to do 10 or 15 up-and-coming markers that are looking really good in the scientific literature but haven't been tested in patients yet. So we're going to test them on these patient samples, and then we're going to see if we can improve PSAs. Cool. So we're looking at a few different things. So some things are quite close to clinical validation, so the translation into the clinic will be really easy. We actually send them off to a lab in the hospital to get that assay done. But other things are really up and coming, and we're trying to work them out here, and it's people here like me and Susan who are doing that work to get these things working. One of the most exciting things is liquid biopsy, but we're going to cover that in another video.
That's a whole
Otherwise
video
we'll be here forever.
Yeah. Okay, so that's one half of the INNOVATE trial. It's all about the blood and the urine biomarker tests, but there's a whole other half as well.
Okay, so the other half is MRI. The reason I go to the hospital to meet these patients is because they've come in for a prostate MRI. So a prostate MRI is like state-of-the-art test you can get. It was developed right here in UCL, UCLH, and now it's being used worldwide. So they do an MRI of your prostate and they can help with that diagnosis, see if there's any suspicious lesions there. So the other part of the trial is trying to improve that. There's some scientists here who've developed this really clever new algorithm, and it's not me, it's some of our collaborators, and they're trialling that out to make the pictures a bit clearer, a bit easier to see what's going on.
So we're hoping a lot of the people watching are patients, and probably the number one question that we get from INNOVATE patients is, what does a prostate MRI even look like? So here's one we prepared earlier.
Okay, so there are various things you can see on this. This is a slice taken through the body, so if Susan was lying down on her back, it would be slices like this through Susan. So this would be here.
Yeah.
Obviously Susan doesn't have a prostate, but if she did, these are hip bones. And then you can normally see the bladder, you can see the rectum, and then this thing in the middle, and it'll be coming up on your screen a bit clearer, is the prostate. So it's a bit more complicated than that. That's just one of the multiple scans they take, and they take all these extra slices. And there are actually 4 different images they get from a prostate scan. If you're interested, let us know, put a comment down, and we can maybe get a radiologist in. We can get someone to explain it in more detail.
We could do like a tour of the prostate video, so if you want that, let us know. So clinical trials do take a lot of time, so how long has it been and where are you at?
3 years in and a few more wrinkles. So yeah, we've been doing it 3 years. We are at patient number 318, so the aim was to do 365. Someone somewhere I think thought we'd do 1 a day, but it's taken a bit longer than that, and you know, Christmas and Easter, we've got to take some breaks. But yeah, so we're really close to finishing, hopefully before Christmas or in the new year, and then comes the fun bit. So once we've got all the samples, and we've actually already started doing this a bit, we start doing all the analysis. So we're dividing the cohort into 2. First cohort, we just play around, we get everything working, we work out who had cancer and who didn't, and we make sure which of these biomarkers are working. Is the urine good? Is the blood good? What's working really well? And then the beauty of the way the trial's designed is there's a second cohort where we blind it. So I won't find out whether these patients have cancer or not, and then we test the biomarkers that are working without knowing the answer to see if it really does work.
Yeah, so it can't just be you really, really hoping that it'll work.
Yeah, like massaging the data,
Yeah, so none of that. This is good, clean science, so blinded to even the research. You've probably heard of blinded trials where the patient doesn't know what drug they're getting. This is all the way through to scientists in the lab not knowing.
So yeah, so it's really exciting. So hopefully in future, and when we get all this done and published, the idea is obviously to improve diagnosis in the GP surgery, give more people like the reassurance that they probably don't have cancer and don't need to go through this pathway, but if they are referred, the MRI is trying to be improved so that they're more likely to get
like a clean answer.
Yeah, like they know whether to biopsy or not, and if they do, where do we go with that needle, because we can see it on the MRI, so that's good.
And hopefully overall less biopsies, right? Because it's a big one. When we talk to patients, like prostate biopsies are a very uncomfortable procedure. There are side effects. It's like an operation, really, and so it can actually cause problems for the patient as well as being uncomfortable. So if we can lessen that, great.
But it's still the gold standard. You know, if you want to know whether you've got cancer or not, we do in the end have to look at the tissue. That's how we make that decision. But if we can spare people having to go that procedure who don't need it, great.
Perfect. So, as Hayley said at the beginning, this trial was funded by Movember in partnership with Prostate Cancer UK, and really we wanted to just take a minute and say thank you to everybody who donated. We know so many people get behind the mental health causes and different cancer causes, and it's tough, you know, doing all those races and cake sales, and it probably doesn't feel like that much money each at a time if you're donating, you know, £2 to the local kid who asks you to sign up for their sponsored run. But it actually does all add up. And clinical trials cost a lot of money. So it's a lot of cake sales and really a lot of goodwill and effort.
But you can really make a difference.
It really, really does make a difference. Like this, if this works, which we really believe it will, then that's changing the lives of men all over the world. Like, it's no joke, right? It's a big, big deal.
So thank you for watching. And any questions? In the comments. Anything you want to know more about, let us know, and we'll see you again soon.